This is Dr. Brendan Cochran from Interactive Health Clinic, here to talk about this virus that I'm not allowed to say the name of because of obvious censorship that is on social media. So this virus that's going around currently, one of the things I've been getting a lot of question about is this new vaccine that's coming out. And there are pros and there are cons to this vaccine that is currently out. Here's the thing that I have a lot of unanswered questions about. One, if a person gets it, is it going to prevent transmission of that person to another person? We don't know yet. Two, what population of people aren't going to tolerate this? We have two people that did have an anaphylactic reaction already to this. Now, mind you, they were already very hypersensitive. So if you have an immune system that's hypersensitive or very sensitive to things, it's not a good idea for you to jump right in and get this right now, because the likelihood of you having a bad side effect is much higher if you're one of those hypersensitive patients, right? We just don't have enough data yet. The other thing that we don't know yet is this going to form antibodies which actually work to prevent you from getting an infection, say, a year down the road, 2 years down the road? We don't know that either. Is it going to have to be like the flu vaccine where we have to get it every single year? We don't know yet. Another thing that is concerning is there's antibody-dependent amplification, which basically can be a very bad thing, right? That means you get this, everything's fine. When you do come in contact with this, however, your immune system gets incredibly ramped up and it increases your chances of things like autoimmune disease or other further complications. We don't know that as well yet. So these are just a few things that are very concerning in my mind that we don't know. We don't know the long-term side effects of this, right? We know some short-term is very similar symptoms that you have to the virus. So low-grade fevers, headaches, fatigue, the list of the current virus going around. What we don't know is what are the long-term things? What are the things after, 2 months? What does that look like? Does that increase your risk of developing chronic fatigue syndrome? Does that increase the risk of you developing an autoimmune disease in the future? We don't know those things yet. So here's the caution I have with this. We need to be careful, we need to watch. And personally, I always like to see how is version 1 and how can we work the kinks out. It's just like when you buy maybe a new vehicle or a new piece of equipment. Most of the time that first year when they come out with that first model, it has a lot more problems than the second model. So my thing is, likely we're gonna work out the kinks on the first model, quote, that's coming out, and then we'll have a better understanding of what the second model looks like, and it often gets better from that. So that's one caution I have to put out there when you're looking at, do I get this or do I not? Now, if your risk factors are significant, where you're in contact with people all the time, you're in a very serious situation, you have immune compromised situations that could put you in a state of life and death, then it may outweigh the risk factors to get this versus not getting it, right? And that's really where the personal decision comes that you have to make going forward. There are better methods out there than what our media is showing you. Right now, unfortunately, the way media is geared, the way we act in conventional medicine is really fear-based, right? Wait until it becomes really bad and then we need to do the surgery, or wait until the cancer becomes really bad and now you're reliant on our chemotherapy and radiation only, and there's nothing else you can do. That's a fear-based medicine. And right now, what we're seeing in media and all the news stations is this fear-based. There's nothing we can do except for this one thing. And I would say this is false. This is absolutely false. There are lots of things that you can do. We learned this back in the Spanish flu when we had our doctors that were naturopathic medical doctors. They were DOs that were doing good naturopathic or nature cure techniques. They had great results back then. So what are we doing now? We have some incredibly smart people out there coming up with some incredibly smart protocols. You know, you've heard me talking about all the research out there on some supplements in my past videos. And another big drug that we're finding more findings. I mean, since October, we just started talking about this. There have been tons of research coming out since October on how well this drug works off-label, and it's called ivermectin. Okay, ivermectin, you may have heard of it as the eye mask plus protocol. This is not something I'm making up. This is from some of the top research doctors or research contributing doctors in the world have basically concluded that this drug, given to people who are at high risk exposure or given to people in early stages, significantly can reduce the mortality or complications. Now notice that means that you're getting it early though. That does not mean that this works later on. So if you have come down with this virus and you're several weeks out and then you contact one of the doctors like myself that understands these types of protocols and understands how to work with your immune system, it's often too late. So it's better to get right on it early than wait, because what we're seeing a lot of in the clinic is people that call, say, a week or 2 weeks after they've gotten into this. They're noticing those long hauler symptoms that you may have heard about from somebody else or on the news. Long hauler symptoms include chronic fatigue, where you just really can't get yourself going, right? Chronic headaches, autoimmune diseases. Those are things that we're seeing with the long hauler symptoms. And the long hauler symptoms are not new. We see this with other viruses. We've seen this with other infections. It's just this specific virus tends to be more aggressive at causing those long hauler symptoms. And yes, there are things that we can do to reverse those issues. They're no different than what we do with other viral infections or other chronic illnesses. It's really maximizing why is your system going into default. A lot of that has to do with nutrients. It has to do with chronic infections. It has to do with getting your engines running, called your mitochondria. A lot of those are the basis for addressing these things. So if you're interested in learning more about that, and you're interested in our approach to that, give us a call, at interactivehealthclinic.com or 425-361-7945. We're here for you. Our doctors are here for you. And basically, we're trying to keep up with the most cutting-edge integrative therapies there are. Integrative means both medication-wise and natural therapeutics. That's what we want. It's really what is best for you as the patient, not a side of is it natural or is it a drug.